Hello, this is Speak Up. In this first video, we're going to discuss the broad and often misunderstood term suicidality. What is suicidality, and how can we use more specific terms to identify those at risk? A variety of terms are used to describe the phenomena that lead to suicide, such as suicidal ideation, also referred to as suicidal thoughts, and suicidal behavior. When discussing suicidality, language is important. Lack of understanding of terms can result in failure to recognize suicidal behavior and labeling behavior as suicidal when it is not. This can complicate assessment and treatment strategies for individuals experiencing suicidal thoughts and behaviors. The term suicidality is an umbrella term for self-injurious thoughts and behaviors with the intent to die by researchers and clinicians to simplify suicide terminology. However, using the term suicidality is not considered clinically helpful, as the more specific constructs of ideation, behavior, attempts, and suicide and their subterms. Yet the distinctions between these constructs are not always made clear. Clarity is essential in practice, since individuals thinking about suicide may fail to disclose their thoughts or be unable to talk about their desire to die before considering or engaging in suicidal behavior. Furthermore, suicidal ideations and the progression to suicide attempts are distinct processes with different predictors and explanations. We conducted a concept analysis, and in this analysis we found that the term suicidality is used to describe a broad scope of conditions that exist along a spectrum of thoughts and behaviors. In this diagram that we created, you can see here that the suicidality spectrum begins with suicidal ideation, which can be passive or active. Passive suicidal ideation may include intense, repetitive thoughts of wishing to die, or being killed, or dying from a fatal disease, or simply just wanting to go to sleep at night and not wake up. Active suicidal ideation is defined as an intense desire for suicide with a specific plan. Suicidal thoughts can progress to passive suicidal behavior, such as collecting pills or buying a gun with the intent to die, but not attempt suicide. Or active suicidal behavior, such as walking into traffic or driving recklessly with harmful intent, then non-fatal or serious suicide attempts, ending with suicide as the ultimate consequence. The red arrow starts with suicidal ideation and moves along the path toward suicide. This represents the risk factors consistent across studies. The center arrow represents intention. The stronger the intent to die, the greater the risk for suicide. This bottom arrow indicates the consequences of suicidality. Each level or point on the spectrum may lead to various consequences. Now, this diagram is not meant to simplify suicidality. In fact, it is complex and multifactorial, as depicted by the curved arrows along the diagram's perimeter, which indicate the process of suicidality is not linear. There is no straight line or exact trajectory. For example, individuals who report passive thoughts about wanting to be dead are at risk of a suicide attempt or death by suicide. Those with a suicide plan who engage in active suicidal behaviors with the intent of dying may deny having suicidal ideations, but are also at risk for a suicide attempt or death by suicide. Understanding that suicide progresses along a spectrum of thoughts and behaviors is essential, as it provides the opportunity to intervene at any level of the suicidality spectrum, promptly and appropriately, to prevent the progression towards suicide. Now, I'm going to be unpacking the details of each aspect of the suicidality spectrum in separate videos, so please stay tuned for future videos. And thank you for watching, and we'll see you next time. Together, we can make a difference.